Hello everyone, my name is Dr. Sajeda alabdalla. Today I will going to discuss the leukemia. Okay, so firstly, what is leukemia mean? It's a type of blood cancers that affect the body. It have a lot of types and manifestation and complication. So let's start talking about each one step by step. So the firstly, what is the definition of leukemia? It's a broad term for cancers of the blood cells. The type of leukemia depends on the type of blood cells that become cancer and whether it grow quickly or slowly. So the leukemia it's have a variation because some of cells will grow quickly and some cells grow slowly. So the slowly will become a chronic disease and the quickly growing it's called an acute leukemia. Okay, so it will occur at any age, but it's mainly in adults or children less than 15 years old. Okay, so how the leukemia form? One special type of blood cells inside the bone marrow affected by several genetic mutation, not just one mutation, and the cells will have an abnormal growth and abnormal function. Okay, so may the cells will grow but without any division. When it's happened, the bone marrow will contain a lot of type of non-functional, non-dived blood cells that will affect the other type of blood cells like the platelet or YBCs. Okay, so all of that will lead to produce and signs and symptoms of leukemia. According to the cause, there is a unknown cause for leukemia because it's have a combination of genetic and environmental factors. So, according to the environment, according to the um, genetic type of patient, it will affect. And maybe I think the radiation. Okay, so what is the risk factors? Previous cancer treatment. So if someone have a cancer before, then he treated from these cancers, he will may develop an leukemia. And the genetic disorders like Down syndrome, it's have an associated risk with leukemia. And exposure to a certain chemical like benzene and um, gasoline and a lot of things that but it's not يعني, surely related to the leukemia and the smoking and the family history of leukemia if the patients have a mother or father have a leukemia. Okay, so how it's classified according to fast of leukemia progression. We have not to type, it's a lot of types, but here's we have an acute leukemia. In this type, the abnormal blood cells are immature blood cells. It's called the blast. So when you make a blood film for your patient, you will find a blast cells. So these blast cells, it have a no function. It's multiply rapidly with no division. So it will have a lot of uh, progression and it have a lot of adverse effects. In the chronic leukemia, it's many types of chronic leukemia. Um, it goes to fewer cells to be produced. We have anaplastic cells, but it's few, less than 20%. And in the bone marrow, it's not infiltrated completely with these immature cells. So, but here in this type of chronic leukemia, the cells will become mature and without any function. Okay, and we have the second classification according to the white blood cells affection. We have an lymphocytic leukemia and myelogenous leukemia. Okay, so what is the lymphocytic leukemia? It's when the lymphoid cells become a lymphocytes, so which infiltrate the lymphoid tissue and that will affect the lymph nodes and a lot of system in the body. And the second type here is myelogenous, leukemia. This type of leukemia affects the myeloid cells, and the myeloid cells give the rise to RBCs, YBCs, and platelet production. So all type of blood cells. Okay, so here's what is the symptoms. So here's the symptom is vary according to the type of leukemia, but at general, we have a certain symptom. It's called a P symptom. So what is this P symptoms? This P symptom is a three due to hypermetabolic state like fever and fever, sweat, night sweat, and weight loss. So these three symptoms will make you to think about the leukemia. Okay, and there is other type like weakness, frequent or severe infection due to decrease the YBC count, and the swollen lymph node, enlarged liver or spleen, easy bleeding due to a decrease of the platelet count, and recurrent nasal bleeding. And you will find red spots in the skin, petechia or ecchymosis, according to the bleeding under the skin due to platelet dysfunction, and excessive sweating, especially at night, P symptoms. And maybe you will find an bone pain or tenderness due to these cells will affect the bone and the joint. How you can diagnose this leukemia? First things, here's the physical exam and the blood test. Physical exam, when you ask your patient what you have as symptoms, and the risk factor for this patient. During taking the medical history, you will ask your patient if he have an special symptoms or special risk factors. So if your patient tell you that I have a swelling lymph node and swallowing problems, and I have an uh, problem in my abdomen, it's become fullness early, and early become a hunger, or another type. Or if your patient tell you that he have an early status 5. Okay, so the blood test, you will make an CBC and the blood film. In your CBC, you may find in pancytopenia or pancytopenia or anemia or thrombocytopenia. But it's as the most common, you will find an pancytopenia. Okay, in the peripheral film, you will find an myeloblast or other type of abnormal cells count and shape. Then, if you find all of these things, you will make an bone marrow test by biopsy to be surely that this patient have a leukemia. This is the most diagnostic test by using a needle, the specialized test for the leukemic cells. Okay, so the treatment will be considered according to the problem of the patient and according to the age, according to the severity. We have and according to the type of leukemia, we have an chemotherapy. The chemotherapy, it's not always the treatment for all kind of leukemia. If the leukemia is acute, you will assess this type of therapy, and we have an target therapy for special disease or for special types of leukemia. And we have the radiation therapy to make an uh, for يعني it will make for affected lymph nodes mainly. If we have an enlarged lymph node, we can use it. And we have another type of treatment. It's called a supportive treatment. We will learn our patient what we meant by leukemia, and how he can be take the care, and we will ask the family to keep friends and close to the patient, may find someone to talk with them, and take care of the patient by special by coming to take the therapy and to make the special test with the end. So thank you. I hope that will be a benefit to you. Best wishes.